Achalasia, symptoms, treatment options, and surgery. What is achalasia? Achalasia is a disorder in which food and liquid have a difficult time passing from the esophagus, feeding tube, into the stomach because of a blockage at the junction between the esophagus and stomach. Achalasia is a rare disorder that affects about 1 to 2 out of every 100,000 people. The most common symptom is difficulty swallowing solids and liquids. In order to understand how achalasia causes symptoms, we need to understand how food travels from the mouth to the stomach. After food and liquid passes through the mouth and into the throat, it then enters the esophagus. The human food pipe travels down the esophagus, and then across the diaphragm and into the stomach. The connection between the esophagus and the stomach is thick muscular valve known as the lower esophageal sphincter, or lay for short. The lay normal stays closed, much like a gate. When food enters the esophagus, nerve signals tell the lay to relax and open to allow the food to travel across the lay and then enter the stomach. In achalasia, the nerve signals that tell the lay to relax and open are no longer working correctly, so the lay stays relatively closed, allowing only a small amount of food and liquid to pass across it into the stomach. Over time, the slow food traffic across the lay causes the food and liquid to build about the lay in the esophagus. This is similar to a multi-lane highway closing down to one open lane and causing a traffic buildup before the lane closures. As the food and liquid backs up and sits in the esophagus gets bigger and bigger, dilates, and over time, less and less food and liquid travels across the tight lay. This results in the symptoms of achalasia. What are the symptoms of achalasia? The most common symptoms are difficulty swallowing, dysphagia, liquids and solids, followed by regurgitation of undigested food from the esophagus. People can also have difficulty belching, chest pain, and a feeling of heartburn. Other symptoms include hiccups, a fullness in the throat, globus, and bad breath from the food sitting in the esophagus. In rare case, after regurgitation, food may go down the windpipe, resulting in coughing and other respiratory symptoms, aka aspiration. In most cases, achalasia starts out slowly, almost unnoticed, and progresses slowly. Some patients will have symptoms for almost 4 to 5 years before they are diagnosed with achalasia. Weight loss can develop over this time. How do patients with achalasia eat? Sometimes patients will adapt by eating and drinking slowly. Also, to help improve the emptying of the food pipe into the stomach, some patients will lift their neck or throw their shoulders back while swallowing. How is achalasia diagnosed? Usually, the symptoms of achalasia indicate the diagnosis fairly well. However, some studies are needed for confirmation. A barium swallowing involves drinking a chalky liquid, and X-rays are then taken as the liquid travels down the esophagus into the stomach. The liquid shows the outline of the organs and the lay. In achalasia, a barium swallow will generally show a very large, dilated, esophagus, which then narrows down to a tight lay, bird's beak. Another important test, called a manometry or motility study, can confirm the diagnosis of achalasia. In a manometry, a thin tube is passed through the nose into the throat and esophagus. The tube measures how well esophagus and lay work while taking solids and liquids. The test takes about 1 hour. Another test, endoscopy, is necessary to ensure that a mass or cancer is not the cause of the swallowing difficulty. An upper endoscopy is a test where a specialist inserts a thin flexible camera down your esophagus and into your stomach, usually investigating the cause of some abdominal symptoms such as pain, vomiting or heartburn. How is achalasia treated? There are several ways to treat achalasia. The choice of treatment depends on a mix of surgeon recommendation, patient preference, patient factors, and available expertise. The aim of treatment is to open up the lay to allow food and liquid to pass through easier and relieve the blockage. The 3 major treatment options are dilatation with a balloon, and endoscopic procedure called POEM, and minimally invasive surgical myotomy. Pneumatic dilatation is a procedure where the lay is opened up forcefully, but carefully and slowly, with a balloon that is progressively filled with more air. POEM is a procedure where an upper endoscopy is performed to release the tight muscle fibers of the lay, like the layers of an onion, and loosen up the opening. Minimally invasive surgical is a procedure performed through small incisions where the tight muscle fibers of the lay are released, like the layers of an onion, to loosen up the opening. If you have been diagnosed with achalasia, you should discuss your diagnosis and treatment options with a surgical specialist that performs the above procedures.